Chronic pain is a problem facing more than 76 million Americans. They take pills, try shock therapy, but the pain is still there.
That's all changing, though, thanks to a local doctor with a machine his patients call a miracle. ABC 6 reporter Erica Ritchie is live in the studio with a story you'll see only on 6. Erica?
Well, Alton, that's right. We're talking about the type of pain caused by a botched surgery, chemotherapy, even the stub of a toe. Chronic pain sufferers, you know who you are. Your medicine cabinet is stocked with pain pills, but you know if they work, it's only for a little while. This new therapy, though, is healing the hurt for good.
I forgot what it was like to live pain-free.
For nearly 3 years, Katie Pyatt couldn't do this, let alone this, all because she slipped and fell at her Houston office.
I had a really bad ankle sprain.
The then 22-year-old didn't think too much of it until 6 months later. The pain in her right foot was so bad, it crippled her.
It's like playing out in the snow with no gloves on and then coming inside and putting your hands underneath warm water. It's that burning.
Doctors diagnosed her with CRPS, complex regional pain syndrome. It's pain that's gone rogue. The thing that caused it, like the sprained ankle, heals. But the pain itself takes on a life of its own, seemingly immune to the treatments on the market.
And I was taking hydrocodone, I was on Oxy for a little bit, pretty much anything out there, which it never helped.
Then Katie heard of Dr. Stephen D'Amato here in Rhode Island.
Today, the first time we're going to be able to venture into your toes with these electrodes now.
Dr. D'Amato practices a breakthrough treatment called scrambler therapy at the Calmar Pain Clinic in North Providence. He's the first in the country to do so.
I was the first medical doctor from the United States to be personally trained by the inventor of this technology.
Italian Dr. Giuseppe Marineo figured out how to use electricity from this machine to not only treat chronic pain, but in some cases, cure it.
What we're doing is picking up the nerve pathways that go from your feet up through your spinal cord and up to the brain, delivering this message of non-pain.
And it seems to be working. Dr. D'Amato has an 89% success rate treating CRPS, 87% when it comes to failed back surgery. But the procedure is also effective for things like spinal stenosis, chemotherapy-induced pain, and low back pain.
This should be the go-to therapy.
It's non-invasive, non-chemical, and there are no known side effects. The machine puts out about as much electricity as static. But what does it feel like? Dr. D'Amato let me see for myself.
It feels like a little needle, like when you're getting blood drawn.
A little pinching sensation. Nothing uncomfortable, it's not hurting. Right?
Except I have a very low pain tolerance.
But if you were in a lot of pain...
Now it's kind of tingling.
Now that's the tingling.
And now this one's starting.
Tingling. Exactly. And that tingling now, if you were in pain here, your pain would be gone. Okay.
So now a typical patient would endure 5 days of this on, 2 days off, another 5 days on, and then ultimately, hopefully, the pain would be gone.
But it's one of those, you have to see it to believe it.
Like many, Katie was admittedly doubtful about the therapy. Remember, she'd been suffering since 2008 and had undergone several unsuccessful treatments. But one day with this machine convinced her.
I have no pain. I'm just so happy. I can't stop smiling now. Scrambler therapy is now being used to treat wounded soldiers at the Walter Reed Medical Center in Washington, D.C., and Dr. D'Amato is the one who trained the doctors there.
Wow.
John and Allison, pretty amazing, isn't it?
It really is. Is this covered by insurance?
It is not as of right now. They are in the process of working toward that, so if you typically have that 5 days on, 2 days off, 5 days on, it costs you about $3,000, but not everyone needs that many days depending on what type of pain and how long it's been there. So.
That relief was written all over her face.
Yeah, just to see that smile, and she told me her first day with no pain, she was just crying and sobbing uncontrollably because she thought her life was over at 22, and now she's got it back again.
Awesome. Great.
That's great.
Thanks, Eric.